So the first step is going to be scoring your legislators. And to do that, you need a scoring system. So the first thing I want you to do is to download the legislative scoring system worksheet. Now, in the middle of the sheet, you're welcome to use our sample scoring system. This will probably work fine if you're advocating for HR 676 or the Sanders bill in the Senate, but you are also welcome to develop your own scoring system. Now, the goal of the scoring system is that each level of support should have one or more measurable actions, observable actions, that will earn the legislator that level of support. Now, for our sample scoring system, we just have 5 levels of support. There's legislators who are hostile to the issue. These are people who have actually spoken out against single-payer healthcare. We have folks who are neutral, who basically haven't put themselves on the record one way or the other. They haven't come out against, they haven't come out for. Maybe this is intentional, maybe they just aren't educated about the issue yet or haven't really been pushed on it. The next level is leaning supportive. In this category, we usually put former co-sponsors of the bill who are not yet back on, and those who have done things that publicly, very explicitly put them on the record in support of single-payer healthcare, but who are not yet co-sponsors of the bill. The fourth level we just call supporters. This is the most straightforward. This is whether they've co-sponsored the bill or not. Then our highest level of support, we're calling it champion here, you can call it whatever you want, is legislators who are not just co-sponsors of the bill, but have gone above and beyond. So for example, those who have support for single-payer healthcare on their website as part of their platform for what they stand for, maybe legislators who put it in their campaign literature, those who publicly speak at events in favor of single-payer. You can choose one or more of these, and you could even have a ladder of leadership if you wanted to go up higher and higher levels of support. Now, I want to make a couple of notes here. One is about hostile legislators. Now, obviously, it's going to be difficult to have a measurable action that would move legislators from hostility to neutrality. And it's hard for legislators to take back things that they've said publicly against your issue. So probably the measurable actions are going to be moving them from neutrality and beyond. But this is okay, since in most campaigns, you are not going to spend much time targeting legislators who are hostile to your issue. The other quick note I wanted to make is about the importance of having levels of support that go above and beyond just co-sponsoring your bill, and to have measurable actions that legislators can be asked to take beyond that. What I see a lot in our movement, and actually every social movement, is we'll have legislators who are signed onto the bill, but often their constituents will feel like they're not doing enough to advocate for the cause and to advance the movement. But sometimes they don't have concrete things that they've asked the legislators to do above and beyond co-sponsoring the bill. So you have to know what you want them to do to take leadership on the role. You can't just feel resentful that they haven't, on their own initiative, taken on more leadership. So this is a really important part of this legislative training. And also sometimes local organizations forget to pressure their legislators to get them into leadership roles, which is an important part of this whole organizing process. All right, so once you have your scoring system, it's time to actually go through and score all of your legislators. And this is going to vary depending on the geographic scope that you're tackling. If you're just going after the 2 senators in your state, this is going to be a very easy scoring process. Here in Massachusetts, we have 9 congressional reps, which is somewhat time-consuming but manageable. If you're scoring all of the state legislators in New Hampshire, you better have like a warehouse and print out like 1,000 of these pages, because it's going to take you a week. So I'm going to walk you through an example. I sort of very quickly scored all of the congressional representatives in Massachusetts just to show you what this can look like. And I should say as a caveat that I used to run the Massachusetts Single Payer Organization, but I haven't done that for 4 years, so I'm a little out of the loop. So I wouldn't take any of these ratings as gospel. It's mostly to show you how this system works. So according to my scoring and my notes here, in Massachusetts, we have one sort of true leader on single-payer healthcare, which is Jim McGovern. We have 2 other representatives who are supportive of HR 676 who are on board as co-sponsors. This is Catherine Clark and Michael Capuano. I think both of them have leadership potential, but they need to be asked and sort of encouraged to take on more and more leadership. Then we have 4 neutral reps, And one rep who I'd say is bordering on hostile to the issue, who's had activists going after him for practically decades and has strongly resisted supporting this issue. Now, very important, moving beyond just having a score, you want to take notes to explain why you've scored them in this way. And the notes are really going to help you with prioritizing who you're going to focus your time and your efforts on moving. If you look at the 4 legislators in Massachusetts who we've scored as neutral, as scores of 2, you can see that there's, when you read the notes, there's actually a big difference between, for example, Nikki Tsongas, who has been pressured by constituents over many years to support single payer, and I think has intentionally not stuck her neck out in either direction, hasn't opposed single payer, hasn't supported it yet, and Joseph Kennedy, who's also scored as neutral, but he's a newer representative. He's been seeing a lot of pressure to support single payer in recent years, and we just recently found out, for example, that one constituent of his got an email saying that he does support single payer, but he's not on the bill yet. Now, if he had said that in a public setting, we would probably categorize him as leaning supportive. But there's a big difference between those two. And this gets me into the very final step of this process, the scoring process, which is using your scoring worksheet to prioritize who you want to organize. Because if you're like the rest of us, you don't have the time and the resources, the staff people or volunteer manpower to go after everyone at the same time. And if you try to, you're probably going to do a bad job of all of them. So you just want to pick one legislator, and we're going to work with that one legislator for the rest of this training. Now, unless there's a compelling reason to do otherwise, my philosophy is to pick any legislator that is easy to move up to the next level of support and to prioritize that, no matter where they are, whether they're neutral and you think you can get them leaning supportive, whether they're leaning supportive, you think you can get them on board the bill, or whether they're on board the bill and you think you can get them into leadership. Now, if you're in the middle of a big co-sponsorship push, then maybe you want to prioritize everyone who's leaning supportive or who's neutral. If you're trying to build leadership, if you're doing that, if you're in a phase where the bill is quiet and you just want to develop your existing supporters, then you can focus on that. But otherwise, you want to go for the low-hanging fruit, because probably you can get them to move up to the next level of support with the least amount of effort, the least expenditure of resources, and then you can move on to the next legislator to target. So for example, we have one representative in Massachusetts, Stephen Lynch, who at the moment is not on board HR 676 as a co-sponsor, but has been in the past. He's not the most progressive Democrat in the House of Representatives, but he's very close to organized labor and particularly a lot of unions in the state who do support single-payer health care. So if I had to prioritize one legislator to move on this map, it would definitely be Lynch.